surgical planning. And we'll talk a little bit more about this, the AR overlaps, the the integration intraoperatively, some of the challenges that would potentially can be seen there, and more use of applications in pain management and therapy. So again, a lot of really exciting things that are being done both with augmented and virtual reality, and I think these are very complementary to the 3D printing as well. Some of the work that we're doing specifically at Serum Medical is using AR and VR for, and specifically augmented reality for printing and planning customized pre-surgical planning models that can be used to use for training, education, and planning. This is an example of a heat map here where we've taken the thickness and shown the thinnest areas in red, the darkest, thickest areas in green for a patient with an acetabular fracture. And we found, in particular, one of our most recent customers at UC Davis is using this to help better train and educate orthopedic surgery residents. We found that using AR, that the surgeons can better, the trainees can better classify the fractures properly and get this classified more early on in their training and get it classified correctly. And we know that the classification really drives the management. Is this conservatively managed? Is this managed with one type of operation or another? And so particularly for complex fractures in the acetabulum, we found that this has been really useful for trainees. And this is, again, very complementary to, I think, 3D printing in the sense it can be used for rapid prototyping. This can be used for visualization. So a lot of things that I think are very good complements to this technology. And as we're seeing both in both the sides of AR, VR, and 3D printing, improving precision and outcomes. So again, some of the early studies that we've done looked at using this to better help surgeons to preoperatively game plan, how long will my surgery be? What type of equipment will I need? Rather than doing things on the fly intraoperatively, they're able to think through this case and go in, walking in with lower cognitive load, meaning there's fewer things buzzing around in their mind when they go into the surgery. They know what tools they're going to use, about how long the case is. All the other people know they have the right equipment there. So we found a much better, smoother case. It really allows for personalized treatment and planning. So again, patient-specific designed implants, these can all be really helpful for advancing the case. And patient education is a really another interesting idea that we've been using this for, and better helping the patients themselves to understand their process. So we did a study up at OHSU looking at this for spinal fractures and spinal trauma, and helping this to better explain to the patient, what's going on, what treatment will we use, what is the problem,